SOMED, Cervical Cancer Prevention Awareness and Health Matters. Your partner in health matters, dedicated to promoting awareness of both male and female issues.
Hello everyone, my name is Edna Dapa and welcome to my channel. In my previous video, I talked about abdominal vaginal bleeding as a symptom of cancer of the vulva. Today, I will continue the discussion with cancer of the vagina, and I will urge you to please join me in this delivery of information and awareness of this disease to support the wives, daughters, cousins, nieces, aunties, mothers, and grandmothers. Today, I will focus on the relationship of abnormal vaginal bleeding with vaginal cancer. Please refer to my previous videos for continuity of this subject. The vagina is about 9 cm long, elastic, muscular, soft, flexible tube that connects the uterus to the outside wall. It has so many functions, including acting as an outlet for the menstrual blood flow out of the body and a cavity for sexual intercourse. It is also a birth canal through which baby is pushed from the uterus out of the body. The walls of the vagina are made of muscular, thick and elastic tissues that enable the organ to accommodate both the movement of the penis during intercourse and expands to provide a channel for delivery of a baby from the uterus. The vaginal lining has several ridges that permits expansion of the vaginal cavity. Ridges tend to disappear in older women and in women who have had children. The vagina has self-cleaning property due to its slightly acidic environment that prevents most bacteria from surviving in it. Vaginal cancer is a rare disease and mostly affects women over 60 years of age and rarely occur in women under 40 years. The cause of the condition is not clear, but the disease arises when healthy cells acquire a genetic mutation that turns normal cells into abnormal cells, changing their growth pattern and develop into a lesion or tumor. Sexually transmitted high-risk HPV could cause this mutation. If the cancer begins in the vagina, it is called primary vaginal cancer. But if the cancer begins in another part of the body and spreads to the vagina, it is referred to as a secondary vaginal cancer. Vaginal cancer could be asymptomatic because some cases may be discovered during a routine pelvic examination. The symptoms of vaginal cancer include unexpected bleeding between periods, bleeding after menopause or postmenopausal bleeding, and bleeding after sex or postcoital bleeding. Vaginal discharge that smells or may be blood-stained, vaginal pain during sexual intercourse, a vaginal lump or growth that can be felt, persistent vaginal itch and pain when urinating, persistent pelvic and vaginal pain. Many of the symptoms mentioned are also likely to be due to other conditions, such as infections. It is vital to get any of these symptoms checked with medical professionals. The cause of vaginal cancer is not known, but there are several factors that may increase the risk of developing the disease. Age is a risk factor of the disease, as vaginal cancer is a rare condition in women younger than 40 years. Statistics shows that 40 out of every 100 cases, or 40% of cases, occur in women aged 75 and above. Also, about 7 out of 10 vaginal cancers are in women over 60 years. It is also a fact that human papillomavirus HPV infection is present in more than 70% cases of vaginal cancers. HPV is also present in more than 90% of women with precancerous changes in the vagina, making it certain that HPV is a risk factor for vaginal cancer. Early exposure to HPV at an incredibly young age through early onset of sexual activity is also a risk factor of vaginal cancer. Smoking could double the risk of vaginal cancer. Women with human immunodeficiency virus, HIV or AIDS, may have an increased risk of vaginal cancer. The infection weakens the immune system and enables HPV to flourish in an immunocompromised system because the body is less able to overcome HPV infection. Presence of other gynecological cancers such as cervical cancer may have an increased risk of developing vaginal cancer. Diacetylstilbestrol, DES, is a drug that was administered to pregnant women towards stopping miscarriage. DES was only used between 1945 and 1970, and daughters of women who took DES during their pregnancy are more at risk of vaginal cancer. However, prescription of this medication stopped in 1970s, and cancer of the vagina caused by DES is now extremely rare. Certain measures can be taken to prevent incidence of cervical cancer. Such measures include practicing safe sex to reduce the risk of HPV infection, and this could significantly reduce the risk of getting these cancers later in life. Smoking and heavy drinking increases the risk of vaginal cancer, so lifestyle changes of these habits will reduce the risk of the cancer. Regular pelvic examination and pap smears will detect precancerous cells before vaginal cancer develops. Therefore, treatment of precancerous cells will prevent the development of vaginal cancer. Diagnosis of vaginal cancer may be carried out by external and internal examinations for any unusual vaginal lumps or swellings. A doctor or cytologist may pick up signs or presence of precancerous cells during routine cervical screening. Colposcopy examination, during which the vagina is studied in greater details. If an abnormal tissue in the vagina is suspected, a small sample of the tissue will be removed and checked under a microscope for cell changes. A further test such as X-ray and possible CT or PET and MRI scans may be carried out depending on the outcome of the biopsy. Vaginal cancer is categorized in stages to express how far the cancer has spread. There are 4 main stages plus 1 precancerous stage of vaginal cancer. Treatment of vaginal cancer will depend on where the cancer is in the vagina and how far it has spread. As with most cancers, medical team can successfully treat early stage of the disease. We can see that vaginal cancer is a rare disease and mostly affects women over 60 years of age. The symptoms of this ailment, such as vaginal bleeding, may be difficult for this category of women to comprehend. However, with education and awareness on the subject, women will become less anxious and could easily report concern and seek medical help early to save lives. We also know that positive resolution can be achieved at the earliest stage of the disease. Many thanks for watching, and please like and share this video to your friends and family, and subscribe to my channel and click on the bell to notify you whenever a new video is released. See you soon.